Street young mothers face enormous challenges in access to maternal health care, as many are scared to even get near the health facilities given their status. Experts say there's need for collaboration between government and non-government organizations to ease access to maternal services and creating avenues to integrate these young street mothers into society. Miriam reports.
Inside the bubbly central business district of Kampala is Katwe slum, a boiling pot of all cultures and beliefs, where we find 17-year-old who we call Sarah as she prepares to start her day at one of Kampala streets where she ekes a living. We set off for the journey to the street where she sits, waiting for any good Samaritan. During our conversation, Sarah narrates her ordeal. On the streets, Sarah became pregnant and the man responsible for her pregnancy vanished, leaving her in a dilemma of fending for herself. She recounts what she went through during her delivery as hell on earth. Fortunately, Sarah gave birth to twins. She is the new Nalungu of Katwe. At the health center, she was able to pay 400,000 shillings thanks to a village circle where her aunt borrowed the money. A few weeks later, she could not repay the money, thus running to the streets with the hope of raising some money that she could use to clear the debt. Having twins is usually seen as a bundle of joy, but for Sarah, it came as double bundle of trouble. Cast under the shadows of extreme poverty and limited resources, Sarah grapples with the silent struggle of accessing maternal health care with her twin infants. During recent operations conducted by KCC and Ministry of Gender, Labour and Social Development, 240 girls that were picked from some of the streets of Kampala, 9 were young mothers. Katwe, one of the biggest slums in Kampala, is home to hundreds of street young mothers. Striving to make ends meet, the scarcity of healthcare resources looms over the slum, making the challenges faced by street young mothers even more pronounced. On the other hand, there are chances for these young mothers to access health care and other reproductive services, though hindered by lack of information on the subject, among other issues. A number of charity organizations have often come to rescue some street mothers, though it is difficult given their demographic nature.
To care is really hard. You may go down into the streets, you're able to convince them, you walk with them to a facility, they attend their first antenatal, but they are lost to follow up, they don't go back. You must really be exposed to their hotspots, and some of them are, because of the bias, they don't want to interact with them. So reaching them may be hard unless we use until we are able to use the peer-to-peer approach. That's when we are able to reach out some of these. Being street kids, they don't have a permanent residence. So when we go back to the very first hotspot that we got them from, we may not be able to get them there as well. So which makes the follow-up really so hard.
Whereas these organizations come as hope for the street life, authorities on the other hand say this should not attract more children on the streets.
In all programming for street children, it is our focus not to create a very comfortable situation for children to be on the street. Because the moment we do that, then it is going to develop into a pull factor. Other children who are back in those places will think if you go to the street, you will get all the services that you need. And that means the problem will spiral out of control.
As the campaign to get street children off the streets continues, advocates argue that this does not deprive them of the right to health care. The call for collaboration, therefore, is considered necessary.
If we engage government in policy advocacy for them to come up with policies and strategies that can manage these street young children. Otherwise, just getting them off the street and throwing them somewhere has not solved anything in Uganda. And we've seen that they take them, after 1 week they do what? They come back. But if government works with different CSOs that have shelters, that have services for these young people, especially the street mothers, we shall be able to have more of them, even integrated into the normal system. We can, in those different shelters, they can get the health information, they can get different skills which can support them, and it will avoid them from going back to the streets.
The journey to improving access to maternal health care of street young mothers is intense, given the contestation that they are not welcome on the streets, but addressing issues like extreme poverty, domestic violence, which force these poor souls to the streets, would perhaps reduce a number of them coming and suffering from the streets. Maria Niwomcha, UBC News.
Thank you so much, Miriam, for that wonderful story about street mothers. Moving on from that, the Confederation of Pentecostal and Evangelical Ministries, led by Bishop Michael David Chaze,